So what do you do surgery-wise? Do you saw off that bump? Do you pull the foot over? What do you have to do?
Well, that's a big part of it. Years ago, obviously, bunions were known as coming back. Now, as within the last 10, 20 years, we're really starting to understand the underlying mechanics that cause it. And so it's not just a simple, let's knock that bump off and go to the house. So the bump does come off, but we also have to realign that mechanical distance that's happened in that foot. So a lot of times that means breaking the bone, push it back into the correct location, and then we use an array of screws and pins and plates and stuff to hold it in place while it heals.
When you fix the bunion, when you have to have surgery, what's the recovery time? How long does it take somebody to heal? Does it depend on their age, but let's just say somebody's 62 and a half.
62 and a half, just a day older than me. So it takes bone about 8 to 10 weeks to be fully healed. So until someone can run, kick, jump, push on that foot, it's probably going to be the better part of 2.5 months. But it's a progressive thing, and so usually after a month, people are getting around fairly comfortable in a loose supportive type shoe. To a dress shoe, you're talking probably 4 to 6 months till they're back to normal activities.
Do you have to wear a walker shoe, one of those big boots when you first start?
We do. We start off with the walker early on.
Yeah.
Now, some of the real extreme bunions, we actually have to keep them off of the foot for a while. You might have seen people scooting around town on those little rolling knee scooters.
Yes.
We don't use as many crutches anymore. But for the most part, you're probably talking about wearing one of those large boots, maybe using a walker for a week or two.
What's the long-term results if somebody has a bunion and it's been progressive and they didn't come in until things were really bad, and you fix it up? How do they do a year later and 2 years later? What happens?
Well, these procedures have become much more reproducible. And so what that means is we're getting better and better and better. And so long term, we're just not seeing so many actual recurrences as we used to.
Does it change people's lives? Oh, Dr. Ritchey, thank you, because I no longer have this pain and I'm not having a grotesque looking big toe going over my...
That's one of my favorite things. Bunions are something that you can visually see 1 minute, and in the first post-operative visit, it's gone.
That must be great.
And it makes them feel so much better.